Okay, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything you see is magnified, usually 30 to 40 times on the screen. We've got this blue cannula. It's called a dry dock. That's coming in. We've got a shaver coming through there. This is your torn biceps. See, that tendon's frayed, which is what we expected. Hold the camera, please. Okay, so we're using our shaver here just to smooth out some of this torn labrum. Just for reference, the rotator cuff tear is right here. You can see that hole in the tendon. And so we've got our work cut out there. We're going to look around the rest of the inside of the joint. How's this systolic doing for you? We good? Yeah, we're good. Okay, and so you've got a little bit of wear and tear changes on the glenoid. See how the articular cartilage is a little bit frayed? I don't think it's enough to matter. That amount of chondral degeneration usually shouldn't affect you too much. Hold the camera for a second. We can see that the shoulder's pretty inflamed. You see how red and angry some of these tissues look. And yeah, you can see how red and angry that looks. So we are going to pass a spinal needle through that biceps tendon in just a minute here. I just want to make sure I can see well. Okay, and that's pretty good, so stay level. That's good. So here's our first pass right through the middle. We'll take our relay, and then we'll take a grasper after this. I'm going to run the video a little bit longer than I normally do because I know you're going to be interested in it, being an athlete, and I want to get you that gold tennis ball like we talked about. Grasper. And then I'll need the suture. Okay, so outside your shoulder, what we can't show you on the video is we're going to load that black wire with a suture, very strong suture, and then we're going to pull back just like that. Okay? And so now we have one pass through the, and one pass is not strong enough, and so we're going to make a pass. And we're going to get way up high, almost in the groove. You can see how that comes down. Let me take it for a minute. And that's coming right through again. We may even go through a third time just because of the tearing that you can see there. But we're going to make another pass right there for now. Wait a minute. Okay. So now we're going to pass this through. It's a little bit of a trick here. We don't just retrieve it the same way we did the first pass. After feeding enough of that in, you can see that's how we load the suture, and there's a little hole right there. So we'll back the needle out. And then here's the trick. We go around the biceps and back here to get it. And we do that because it gives us a little bit stronger stitch when we study it in the lab. Okay. And now we'll pull tight. You can see how that stitch, kind of a scissors next, kind of a loop around the biceps. At the very least, I have a strong hold on the biceps. If I need to add additional sutures later, we can. But the next move here is to go ahead and cut the biceps down here so it doesn't create any more problems inside your shoulder. So there, now the biceps has been divided. So if we stopped right there, that would be called a biceps tenotomy. When we reattach it like we're going to do, then it's called a biceps tenodesis. Okay? And so now the next thing is, sometimes we do some work on the rotator cuff from this articular view. You can see how the tear is bigger than it looks because underneath here, this footprint's exposed all the way back around. So it's almost certainly going to be 2 suture anchors, but we'll decide that a little bit later. Okay, so we'll go off on the video. We're going to change positions, and we'll come back up on the video once we've done that. Okay, so we've got our biceps sutures identified. We're going to bring them back into this anterior cannula. We're actually going to do the tenodesis first right now, just because of the biceps and the way it was. And so we're going to put these down. The biceps tendon, just for reference, the front of your shoulders to the right. Your biceps tendon's right here. You can just see it there. And we're going to basically tenodese it in place with an anchor. We'll show you that in just a minute. Punch. Okay, so the biceps tenodesis is done with an anchor. We put some additional sutures in it, and that anchor is buried in the bone, and that's real tight. When we rotate your shoulder, you can see nothing's moving there. I'm happy with that. And now we've got this rotator cuff tear to deal with. Hold the camera for a minute. It looks like we may want to place 1 margin convergence suture, so have 1 more free suture ready to go just in case here. Okay, so we can see where the tear stops. That's posterior on the left. So I think now I have a pretty good idea of what we have to do. We'll go ahead and start placing some anchors. We're going to start by placing our first anchor posteriorly. You'll see it come in right back in this region. Okay, spinal. Okay, so here you can see how we plan the repair. We're going to place 1 anchor in right about here. And now we'll take our guide and get this down a little bit there. And we don't want to be on the articular surface. We want to be just back from it. So I'm happy with the position right about here. Let go there. So there's our triple loaded anchor. We're going to reach in with our crochet hook, so get with me on the sequence here. So we're going to reach in with our crochet hook, then we're going to take a grasper and a suture hook. In terms of which suture we want first, we always take a look. It looks like this black and white one's good as a first pass. Take that, grasper in the front. And now we'll take our straight crescent suture hook. We'll show you one of these. It gets pretty repetitive, but I want to show you how we do it. So here's the hook. And it's loaded with that same black wire we actually used for your biceps tendon. Okay, so we're going to hold right about here with the camera. Give me that. Now here's the key for me, is I don't just want to get that superficial layer. I want to reach underneath and make sure that we get any deep tendon also. It looks like that pretty much is it. As we lift up, you can see that. So we're going to hold this reduced right about here. And if we get down there, I'll be happy. So there's a good shot right there. I'm going to show you some more in a minute. Pause, please. Okay, so here you can see we've got that first black and white suture pass through the tendon. We're about to tie it. Just it gives us a good anchor point. So we'll show you when that's done. Hold the camera. Okay, so we've tied the first suture. And luckily, there's a lot of flexibility left in your tendon. You can see how just this one suture, which we've tied here, look at what a great job it's already done in anchoring down that posterior aspect. Now, we have to put in a lot more sutures, at least 2 more, maybe even a second anchor, because I want to make sure we get this thing anchored down. But just that one stitch has really done a nice job. When we rotate, you can see it's stable. And so now we're going to reach in and get the next suture in line here. And I'm going to go ahead and use this solid blue one like that. Okay? And we'll just keep passing some more. Hold the camera. Okay, so here you can see our next suture. It's got a little bit more of an angle to it. It's what we call a 60-degree turn to the right. And so we're going to reach in here. We're going to grab this tendon. We're going to lift up. I always want to make sure I'm getting the deepest layer. I'll pull that suture out of the way. And we want to hold this right about here. So show me over here to the left. Yep, great. Take the camera for a minute. Okay, hold just like that. Okay, pause. Okay, so we've finished the repair. We put in 2 anchors, a total of 5 sutures. There's the tendon bone interface. And then the biceps tenodesis, that's way over there to the right. So that looks good. I'm happy with that. And now we've got our little magic stem cells to put in like we talked about. And we're going to put 8 cc's. We made 12. We're going to put 8 cc's in the bone. And then we'll put 4 cc's in the subacromial space up here. So we're just getting organized to do that. And then we'll be done. So let me see a spinal needle. No, not right now. Okay, so just checking our angle to put the stem cells into the bone. I think that's going to be a good spot right about there. So that's where we'll start. We'll show you some more. Actually, this will be it for the video, because once we do this, we have to turn off the water, so we'll lose our image. But just wanted to give you an idea. The stem cells, 8 cc's go into the bone right about there. We'll put a little bit into the tendon here, a little bit into the tendon over here, and then the rest of it just goes into the space up above right here. Okay, so a little bit in the tendon, a little bit in the bone, and the rest in the subacromial space. So good luck to you now. Bye-bye. Okay, hold the camera.